1 in 3 mothers will have an induction of labour in the UK. In this film, we are going to listen to the birth stories of 2 women and hear from the members of the maternity team about the care and support they offer. But first, what is an induction and why might you have one?
So an induction of labour is a way in which we artificially bring the labour on for various reasons. That could be social situation, that could be feeling a bit more uncomfortable towards the end of the pregnancy, and that could be because they're generally concerned about sometimes going too far past their dates, or they're concerned about the health of the baby and would like the labour to be sooner rather than later. Equally, your obstetrician may recommend an induction of labour for various reasons. So some people start their pregnancy with certain risk factors, such as diabetes and pregnancy or hypertension. They may need their labour to be induced earlier to reduce any complications to mother or baby. Furthermore, the baby may decide the baby may be growing too small or too big, or the baby may slow the movements down closer to term. And again, your obstetrician may recommend to you it's time to artificially induce the labour. Whoever is providing care for you, your midwife or obstetrician, really does that risk assessment throughout. And if things have changed, then there is always that opportunity to consider inducing the labour so that you can have a safe birth.
Your reasons for having an induction are as individual as you are. But whether you are induced or going to labour spontaneously, there are things you can do which will help prepare you mentally and physically. First, movement.
Movement is such a wonderful thing for you to be doing throughout your pregnancy, but especially in the last couple of weeks of your pregnancy. So going for a really long walk is going to be great because it helps get the baby as deeply engaged into your pelvis as possible, and that is so beneficial for helping labour to start. Going for a swim is a wonderful way for you to feel light, to feel buoyant, but again, it helps encourage your baby to turn around into the right position for labour and birth. And squatting and lunging, and that can be done in your home, up and down the stairs, whilst you're watching TV, whilst you're chatting to a friend on the phone. These are the things I think might really, really help in the process of getting your labour started and going.
You might also try alternative medicine.
Acupuncture and reflexology are a great thing to try. It's all about using your body's own natural mechanisms to encourage your body to release all the lovely hormones and encourage labour to happen of its own accord. It's you taking some time out for yourself to have some self-care and some attention to your body, and that's a great way to boost relaxation.
Touch can also be a wonderful way to relax and help your body produce the hormones it needs for labour to begin.
We know that touching and kissing and cuddling is a great way to help boost all the lovely hormones and help you to feel relaxed. So that could be sex, that could be kissing, that could be cuddling on the couch with your partner, that could be having a really good orgasm. Anything where you feel relaxed, where you feel loved, where you feel touched and supported is a great way to boost all those lovely, happy hormones. And that's a great way to start labour off.
So there are many things that you can do to prepare your body before your labour is induced. First, you can start doing some colostrum harvesting, which we would recommend you do from 37 weeks.
Colostrum harvesting is a process of you massaging your breast to express and help release your colostrum, which is the first milk that your baby would receive. The benefits of this are many. It's a great way to encourage labour and birth because you're releasing all that lovely oxytocin. It's a great way for you to feel more familiar with your breast in preparation for breastfeeding if that's what you want to do. And also you just collect all that lovely colostrum for your baby in the first few days of life that they can have.
And that's a way of actually stimulating your body's natural oxytocin, and therefore that can help to get the cervix a bit more riper to help shorten your induction. There are other things that you can try, such as spicy food, curries, raspberry leaf tea, which are natural, that will help you to get your body prepared.
So let's assume you have decided on an induction and have been preparing for the birth in the weeks and months leading up to it. What is the process of induction and what might happen when you come into the hospital?
You would be given a date and time to come to the hospital by your obstetrician, and you'll be greeted on the antenatal ward by your midwife who'll be caring for you. You would have your birth partner with you, and you would bring all the things, your bags, your hospital bag, packed and ready, and also your frozen colostrum if you'd collected any. It's important when you're coming, also to bring things like a book to read, you can bring some movies to watch, because the first part of induction can take some time, and that's a really quiet time. The midwife will show you to a bed, will then discuss with you why you're having the induction. The midwife will review your clinical notes and your hospital notes to sort of familiarize herself with your clinical situation and with who you are. It will also be a good opportunity to really discuss your birth preferences with your midwife. Once that conversation has happened and the midwife feels that she's got enough information and she's gotten to know you and your birth partner a bit better, she will ask to actually have a feel of your tummy to make sure that the baby's in a right position, so the head is presenting, and she will also at that point in time listen to your baby's heartbeat. She will request that she puts you on the monitor, which is called the cardiotocograph, also called a CTG. And the CTG is a heart rate tracing of the baby's pattern, which tells us how healthy your baby is before we start the induction process. And one of the ways in which we can help you to move your body a little bit along is by something called a membrane sweep.
A membrane sweep is a natural way of trying to initiate the process of labour.
So with the sweep, we want to do it as slowly and as gently as possible. So we're going to start off by getting you relaxed onto the bed or onto the couch. And whilst you're breathing and you're doing a relaxation, I'm going to go and wash my hands and get my gloves ready. And once you are ready, what I'm going to encourage you to do is to make your hands into fists and to pop them underneath your bum and to sit on your fists. We'll do a couple more deep breathing exercises, and then once you're ready, I'm going to start. What you may feel is a bit of cold jelly and the pressure of my fingers. I'm going to feel up to your cervix and take my time and gently examine your cervix. And whilst I'm doing this, I'm assessing to see what your cervix is doing. So how short is your cervix? Is it soft? Is it stretchy? Is it starting to open? And where is your baby's head sitting in relation to your cervix and the pelvis? Once I can gather all that information, I will then start the process of a sweep. And again, we take this nice and slowly and gently. At any point you want me to stop, you just say stop. I expect the sweep might take a couple of minutes, okay? And then once we're done, I will share my findings with you. A sweep is not just about encouraging labour, it can help me to find out more information about what your cervix is doing. And if we're thinking about induction of labour, it helps us to start planning what might be the right method of induction of labour for you.
During your sweep and examination, we use a system called the Bishop score to help us judge how ready you are to go into labour. The Bishop score is an assessment of your cervix. Each aspect can be given a score. This will tell us how dilated or open your cervix is, how long your cervix is, the position of your baby's head relative to your pelvis, how firm your cervix feels, and also the position of your cervix relative to the walls of your vagina. For instance, if you have a closed cervix with a length of 4 centimetres, with the baby's head very high up in the pelvis, and a firm cervix that's very posterior at the back of the vagina, this will be a Bishop score of 0, meaning labour is not imminent. In this case, we might recommend using one of the options to ripen your cervix. However, if your cervix is dilated to 4 centimetres, length less than 1 centimetre, with the baby's head low in your pelvis at +1 or +2 centimetres, your cervix is soft and in the mid position, you will have a score of 12 and probably go into spontaneous labour in the next 24 to 48 hours. So, the sweep is a way of seeing what stage you're at and of helping your body prepare itself. It may even bring on labour, but you may find the sweep uncomfortable.
After sweep, what you can expect to feel is that you might feel a bit crampy in your lower abdomen, a bit like a period type cramp, and that may last for a couple of hours. You might also have a little bit of spotting or a bit of mucousy bleeding because we've stimulated the cervix by doing the membrane sweep.
Then you could always ask your midwife or doctor to provide you some Entonox or Gassanair. If you do feel a bit uncomfortable after, just having some paracetamol may help.
I'm hoping that labour would start within 24 to 48 hours, but for some women, they may feel quite crampy and labour may not happen. We can look at doing another sweep if you want to do it, if you would like to try again.
Now might be a good time to talk to an anaesthetist about pain relief.
So for an induction, for the anaesthesia for an induction of labour, we would start off with simple drugs, such as Entonox, which is a nitrous oxide and oxygen mixture, which is very good for pain. There's also some tablets that you can have. Paracetamol is actually quite good in the early stages. There's a machine called a TENS machine, which just goes on your back and makes a little buzzing and helps with the pain. And then sometimes you can have pethidine. So please be as relaxed as possible.
If you would like further information on your pain relief choices during labour, the Obstetric Anaesthetists Association have a great website here. Now would be a good time to meet our first mother-to-be, Stephanie. We come to her when she's been in the antenatal ward for a few hours. She's had an initial abdominal examination followed by a sweep.
This is my first baby, so yeah, very excited to give birth to my first child. I've been told and I've read that first babies can be later generally than second time babies. I'm 39 weeks and 6 days today, so tomorrow, New Year's Eve would be the day, so just trying to have it on time. I didn't decide that right at the beginning of the pregnancy, but as it went on, I decided, so went for an induction. My birth plan is to be as mobile as possible, to have my birth partners with me, to have music playing, some aromatherapy, and hopefully have a natural vaginal delivery. With me today, I've got my husband, James, who is an amazing support, and I definitely need him by my side for this birth of our daughter. I've also got my mother here, who's an amazing support and also a midwife, so she's got everything that I need to ask her. She knows it all. I came in at 8 o'clock this morning. It first started with having my tummy examined, and then I was put on a monitor to check any contractions and the baby's heartbeat. And then soon after that, I was given an examination to see where my cervix was at. And then around 10 o'clock, I was given the Prostin gel.
This gel comes in different doses. It's in a 1 milligram or 2 milligram, again, depending on the starting point of your cervix. We may recommend different doses. This device is then inserted into the vagina and squirted just behind your cervix. This gel tends to last for 6 hours. So after 6 hours, your cervix will be assessed again.
It's now about 8.5 hours into the process of induction, and I've had a second amount of gel put in. It is slightly uncomfortable, but I used some gas and air to help with the pain relief. James has been an amazing help. We went for a walk earlier, but yeah, he's by my side and hopefully get some sleep later. And I've also got some aromatherapy like lavender oils to smell as well, so that's helping. I'm doing some pelvic exercises to just help the baby move down. It's also very comfortable compared to laying or sitting on a bed. The baby's head has moved down slightly, but the cervix is still as it was before, so we'll reassess in about 6 hours and see how it's going.
As well as Prostin gel, there are some other methods that can ripen the cervix to start labour.
So if your cervix needs a bit more help in terms of ripening, the midwife obstetrician may recommend insertion of what's called a Cook's balloon. This is a bit that's going to be inserted through your cervix. This part here will be inflated with some saline, and this will sit above your cervix, and this bit here will sit beneath your cervix. This bit that's on the top of the cervix is inflated with some saline, and the effect of this is to try and to compress the cervix so that it stretches open. This bit is going to be hanging out through the vagina, and therefore we can then deflate the Cook's balloon through this end to remove it if it hasn't fallen out before 24 hours. Another option that we may suggest to you to help ripen your cervix is something called a Propest pessary. Now this is like a little tampon, and in this little tampon area here, this is inserted through the vagina and it goes just behind your cervix. There's 10 milligrams of prostaglandin in this little tampon, and it's released slowly over 24 hours to help again soften, ripen and open the cervix. This bit will be hanging out through the vagina, And sometimes if you start experiencing regular contractions, or you go into labor with this, we might use the end of the string to pull it out, or at the end of the 24 hours to assess the cervix. If at the first assessment your cervix is nicely ripened and open and soft, and we can feel the waters around the baby, we may just recommend what's called artificial rupture of the membranes, or breaking the waters, or you may hear your midwife saying an ARM. We use a little hook like this to insert and break the waters around the baby. And this would hopefully get your contractions to start naturally on their own. And once we're able to get to that second stage of breaking the waters, you will then be asked to move from the antenatal ward to the labour ward, where that care is provided in a room with one-to-one care with your midwife.
After 2 to 4 hours, your midwife or doctor might do another vaginal assessment to see if there are any changes in your cervix. If you're contracting regularly on your own, say 4 contractions every 10 minutes, then there's no need to do anything else. But if your contractions are not regular, then they may suggest an oxytocin drip. This synthetic oxytocin, called syntocinon, is given through a little cannula inserted in your arm.
The amount that is given is really controlled very carefully by the midwife. The midwife or the doctor will need to monitor your baby closely, and we can do this in two ways. One is called telemetry or wireless, and the other is a non-wireless method. If you're using the wireless, you can also opt in to use water for pain relief, if that's in a bath or in a pool. They would assess your contractions every 30 minutes to an hour, and depending on how often you're contracting, they may either increase or reduce the amount that's given to you during the labor. Once your contractions are started, whether it's naturally on its own or with oxytocin, there'll be some assessments that will happen throughout that part of what we call the intrapartum part or that laboring part. The midwife every hour will check your blood pressure and your temperature, and also look at the fluid around the baby to make sure it remains clear, and to ensure that the baby hasn't passed a poo or what's called meconium inside. So these checks are done every hour. There's sometimes maybe another midwife that may come into the room to really review the heart rate tracing of the baby. You may hear the midwife saying this is called fresh eyes. It means that there's another layer of safety by someone else coming in and ensuring every hour that your baby and you are happy and healthy.
Let's get back to Stephanie and James. We last saw them in the antenatal ward, where Stephanie had had an initial abdominal examination first thing in the morning, followed by a sweep. Stephanie then had some Prostin gel to get things going at around 10 a.m, followed by a second dose of Prostin gel 4 hours later. We now meet them 2 weeks after the birth at home. Stephanie picks up the story for us.
So I had the second round of gel for the induction around 3 p.m. in the afternoon, and was kept on a monitor to check the baby's vitals and to see if I were having any contractions. And then later on I was re-examined. Following that, late in the night around 11:30, I had my waters broken. It was uncomfortable. I found all of the examinations that I've had uncomfortable, even with the gas and air. But it was a relief to have had them broken, because I could see the process moving along a bit more. It felt like it was moving along more than having the induction gel, because something had physically happened. And then was put on epidural, and followed by the oxytocin hormone drip, which helps bring on contractions and start the labour process.
So if you need an epidural, you want an epidural, you have a pre-consult with an anaesthetist who will ask you lots of questions about your back and your general health. And then once he or she's explained the pros and cons of everything, you're usually sitting somewhere, we put a little drip in your arm, and then you sit and bend your back out towards the anaesthetist, and they put some local anaesthetic in there. Local anaesthetic that we use to start with stings a little. That's to make the whole area numb. And then they find the epidural space, you just feel some pushing, and they put the little epidural anaesthesia tube in your back. And then we connect that to some local anaesthetic, which is a very low dose. And you can press a button and give yourself a dose of it. You can't give yourself too much because it won't let you. The good things about epidurals are that they will give the best pain relief. Once you have a successful epidural working, you should be able to go to sleep if you wanted to. You don't feel the contractions as painful. They feel just like, some people are conscious of them, but they feel like tightenings and they're not painful.
Yeah, I could feel the contractions quite strong because of the oxytocin drip. It definitely helped. The main obstetrician who examined me found that after the 4 hours of being on the oxytocin hormone drip, that my body just hadn't made that much progress in terms of my cervix dilating. I was given the choice at that point to stay on the drip and see how it goes, because in the next 4 hours I could make progress and potentially have a vaginal delivery, or I could go to C-section at that point. So that was about 12 in the afternoon. So I decided to wait and see if I could make progress. 4 hours later I was re-examined and I just hadn't made the progress. My body was doing all the work to try and deliver my baby, but it just wasn't possible. So I had to have an emergency C-section, because at that point, during the examination, they found some minor swelling on the baby's head. So it was important to just go for it and just have my baby. I was then taken into theatre and given a spinal anesthesia so that I didn't feel anything from chest down. So it's similar to the process of having an epidural. It's the exact same process. You have an anaesthetist come in and they give you that pain relief.
Although Stephanie had an epidural in place, it was not strong enough for a caesarean, so a spinal anaesthetic was used.
I had my birth partner and husband James in the theatre with me. I don't know what I would have done if he wasn't by my side. And then you are hooked up to all of these machines to check your vitals during the entire process. And a screen goes up, you don't see anything happening. It is a surreal experience because you're lying there, you don't have any feeling below your chest, and then within minutes you're delivered with a baby above this screen. And it is a very emotional process, but it's just amazing to see this baby lifted up. They start crying, they get taken over to this resuscitator on the side, get rubbed up, and then they're just on your chest all of a sudden. So it was a very quick process. I felt very relieved seeing her finally after the experience. It's only until I actually had the C-section that they found the baby's head was turned. So it was great that I could have that C-section and quickly, because it would have been impossible to deliver her naturally with her head turned and stuck in the pelvis. I've been home for 2 weeks now and a day today. At the beginning, it was hard to be mobile. Just, I was taking pain relief at home, which is just normal when you've had a delivery. But I'm feeling much better now. Amazing, considering it's just been 2 weeks, and just happy to, be there for my baby. She is amazing. Just my everything. I'm so in love with her. We just love having her. And
With any birth, there is always a chance that you may need a caesarean, but statistically, you're no more likely to have a caesarean than someone who is not being induced, and possibly less likely. There are, however, things you can do during labour to increase your chances of vaginal birth, even after an epidural.
If you have an epidural, then one of the things I would highly encourage you to ask your midwife or your doctor to use would be a peanut ball, which is a modified birthing ball that goes between your knees. And the best thing to do is get you onto your left-hand side with that. And that is shown to help expand your pelvis and encourage your baby to rotate down into the pelvis. And that's a great way to help maximise your chances of a vaginal birth.
Now let's hear from Robin, another first-time mother who we meet 4 months after the birth of her daughter.
I'm Robin. I am a first-time mum, and this is baby Grace, who's 4 months old and is absolute magic. So I am an older mum, and it was raised fairly early on, the potential increased risk of stillbirth. I guess induction gave me the chance of the potential to have a natural birth. The other option was a C-section. If I had an induction, yes, it might have ended up in a C-section, but so do many first-time mums end up in a C-section, even if they go into labour spontaneously. So in my view, I had absolutely nothing to lose giving it a chance. I started colostrum collecting about probably a week before, I think, and it was really slow going at the beginning. But it got easier, and I found it a really positive thing to be doing, because this way I felt I was doing something good for Grace ahead of time. I elected to have a sweep to give myself the best chance of going to labour spontaneously. So it was about 39 plus 4 when I had the sweep. Yeah, it was uncomfortable, but fine. And I think if you relax beforehand, it makes it a lot easier. So yeah, I was aware of potential for a number of steps in the process, and depending on how I responded, sort of the next step would change. I knew that once I'd started induction, I'd be admitted to the hospital and stay on a ward, and it was busy. I would definitely take something to keep you busy. Mine was overnight, so I technically was meant to sleep, but another piece of advice would be to go as rested as you can into the ward, because you don't get a lot of rest. There was another lady in labour, and so I could hear all these noises that made me slightly hesitant for what was coming. So I'd recommend some headphones, possibly. Some good company helped. It's nice to have someone to distract you from what's going on and to have a bit of chat. And just other stuff to keep you busy, be it books or TV programs to watch, or anything just to distract you, because it is a waiting game. I knew that it would start with Prostin gel, and then depending on that, we'd choose our next steps. I was lucky that it worked, and I was offered, then we ruptured my membrane, and then following that, I needed a Syntocin drip to get my contractions going more strongly. I found breaking of the waters probably the worst bit, and it wasn't painful, and it was just quite uncomfortable and quite strange, and just a sensation, I guess you don't know what to expect, but that was, once it was done, it was fine. And then I was offered a drip because I wasn't progressing as required, and that was fine. And then my contractions started properly, and I opted for a epidural. The anaesthetist came in. He was very kind and friendly and calm. And the actual process, I think I was probably most scared that I would have a contraction in the middle of it and move. But they do that every day, so they know how to manage it, and they know when your contractions are coming. So timing is something they worry about, and they get right. They spray some local anesthetic, I think, onto your skin. I didn't feel anything going on. The next thing I knew, the needle was in, and then you just wait for the relief, and it's pretty quick for it to kick in. But the actual process was painless, and the relief was amazing. I had hoped to go potentially without an epidural, but I think there's nothing like the reality of experiencing it. And in hindsight, I was very glad that I did opt for an epidural, because 12 hours later, when I was still in labour, I would have been exhausted. Yeah, and once I'd had the epidural, pretty great. I mean, it was a bit like a tea party waiting for Grace to arrive. The birth was a bit of a blur. It had been a long day, and not a lot of sleep then or the night before. So I remember feeling her head coming out on its way out, and I remember her being put on my chest, but the rest is pretty much a blur. You come out of it, and yeah, I mean, it's amazing. Yeah.
Both mothers in our film had epidurals. This is very common whether you're induced or not. We've talked about the benefits of epidurals, but are there any potential downsides?
Lots of people are quite worried about their mobility after having an epidural, I think. Many years ago, you would have had an epidural that was very, what we call heavy. So your legs would have been heavy, you couldn't really move very much. Nowadays, we do much lighter versions of the epidural so that your legs can move quite nicely most of the time. After a very long time, they get quite numb and weak, but up to about 5-6 hours, you can move them really well. You can sometimes get a very bad headache after an epidural. About 1% of the time that happens. So if that happens, we can cure it. Sometimes the epidural can only work on one side, so it might need replacing or just adjusting a bit. The next thing people are worried about is nerve damage. That's very, very rare indeed. The figures are 1 in 10,000 a minor problem and 1 in 100,000 a major problem. So the one thing I would say if you're coming in for an induction of labour is not to worry too much about all the things that you've read or heard, because the worries that you have are often totally unfounded, and when you arrive at the time, everything's completely different.
There's lots to think about, too much to fit in one film. If you want to learn more, NICE have published some guidelines on inducing labour, which you may find useful. You can find them here. There have been many studies and papers written about induction. We're going to have a quick look at 2 that deal with the impact of inducing labour and one that looks at minimising instrumental delivery after having an epidural. First, let's look at the ARRIVE study, which examines the risks associated with induced versus non-induced births for first-time mothers.
The ARRIVE study was a study published in the New England Journal of Medicine in 2018, and it was a multi-center randomized control study where they looked at women that they were low risk in their first pregnancy, and they were randomized to either have an induction of labor after 39 weeks or not to have an induction of labor and have an expected management after 40.5 week gestation, between 40.5 to 42 weeks gestation. And there were 3,100 women in one group, the induction group, and around the same number in the expectant management group. Women used to think that if the labor is induced, they would have a higher risk of interventions, higher risk of needing a cesarean section, higher risk of needing an assisted delivery. But the research and the evidence suggests that that is not the case, and it's actually opposite, that women that they are induced at 39 weeks gestation, they would have a less risk of needing a cesarean section, a less risk of having hemorrhage, a less risk of bleeding, and that has actually changed what is the guidance. And of course, this is not to mean that women have to choose to have an induction of labour, but I think it's important for women to know.
You can find the ARRIVE study here. Now, let's look at a paper examining induction in older mothers.
So the Royal College of Obstetricians and Gynecologists published a scientific impact paper on induction of labour at term in older mothers, where they accumulate all the evidence and the information about pregnancy, outcomes, risks in women that they are over 35, 39 and 40. It gives the advice about having an earlier induction of labour. It gives the risk of having adverse pregnancy outcomes, and mainly discuss about the slightly increased risk of stillbirth for women that they are older. It gives the numbers for UK and for the USA, and that does not mean that all women that they are over 40, if they go over 40 weeks gestation, they will have a baby that would be a stillbirth. But I think that it's important for women to know and recognize that there would be about like a 3-fold increase in their risk of stillbirth when they go later on in the pregnancy. I think that it is our responsibility as clinicians that we just give the information to women so that they know what is their risk when they have got different interventions, and then they can make up their mind of what is the right thing for themselves and for their babies.
You can find the paper here. Now, let's look at the bump study, which looks at the best positions for childbirth if you've had a low-dose epidural.
The bump study was a UK study from the University of Birmingham that was published in 2017. A study aiming to look at first-time mums that they had a low-dose epidural and aimed to see whether they had a higher chance of vaginal delivery when they were in upright positions during the second stage of labour or when they were lying sideways. The researchers were initially thinking that women that they were in upright position, that they would have a higher chance of achieving a vaginal delivery, but opposite to their expectations, they find that women that they were lying sideways, they had a higher chance of having a spontaneous vaginal delivery. So, of course, women will be changing positions, and during the active pushing stage, women can actually be sideways, but we want their pelvis to be open. So sometimes we can have the pelvis to be open with them holding one leg or the partner. Sometimes we used to put pillows there to separate the legs, and many people in practice were using a peanut ball, which is like a birthing ball, the shape of a peanut, if we think a large peanut that women put between their legs to just open their pelvis.
You can find the bump study here. I hope our film has shown you what to expect should you come in for an induction. Both Robin and Stephanie went through their own unique journeys, and their experiences, along with the advice from the maternity team, should help you in your journey. Together, we can make this a wonderful experience for you and your baby.